Hi, my name is Christine. I'm going to do a medication demonstration today for oral, subcutaneous, and IM injection today for Miss Millie Larson, and her date of birth is January 1st, 1936. I'm going to do some hand sanitizing. I have my Mars here. It's from Miss Millie Larson. Her date of birth is January 1st, 1936. She has 3 medications. Helpredol, which is Haldol, 2 milligrams intramuscular for control of agitation. Insulin, which is Lispro, 10 units sub-Q, and that is to control her blood sugar. Her blood sugar would have been checked beforehand per doctor's instructions. Docusate, 100 milligram tablet oral, and that is to soften stools. I have my medications here. That's a med cup for her oral medication. And this is her Docusate, 100 milligram tablet oral, Docusate 7/20/24, so that's not expired, 100 milligram tablet to soften stools. Lispro, 10 units sub-Q. Now this is a multi-dose insulin, and it's 10 mLs, 100 units per ml. I did have to do some calculations with this, so this is actually a 0.1 dose. I'll draw up 0.1 in the insulin syringe, which is a small syringe, and I'll give it at a 45-degree angle in her abdomen. I'll clean that off. So you draw 0.1. It is cleaned. And do the swoop technique. And do a label. .1, which is 10 units. Lispro, 10 mLs, and secure that medication. Helpredol, 2 mgs intramuscular to give now for agitation. This is also a multi-dose, and it's 5 mgs/ml. This I had to also do some calculations, and it's actually a 0.4 dose. So I'll draw up 0.4 in an IM medication, IM syringe, I'm sorry. Remember if I cleaned that off? Doubly clean will be better. Get rid of the garbage. This would be a 1-inch needle. I didn't have a 1-inch, so we're just going to pretend. And we're going to draw up 0.4. You can always draw up more and bring back, so just make sure there are no bubbles. And the swoop method. And a label. So this is the helper doll. 2 milligrams, which again is 0.4 for Miss Millie. And then you're going to secure this medication. Okay. I'm going to go in and introduce myself to the patient, make sure she has some privacy, and verify her with 2 patient identifiers. Ms. Millie, my name is Christine. I'm going to be your nurse today. I just want to verify your name. Miss Millie Larson, 1/1/1936. Yes, Miss Millie Larson, 1/1/1936. That is correct. And do you have any allergies? No allergies? And how are you feeling today? Okay, you're okay. I have some medications for you. I have a medication by mouth. It is going to be your Colace, and that'll help soften your stools. I just want to make sure that you are you have no roommate, and you're private. I closed the door. You're feeling safe and no pain. Okay, and you have your juice, and your blood sugar was already checked this morning. Okay, perfect. I have, like I said, I have your oral medication, and I have a sub-Q. So I have your medication for your insulin and also your intramuscular. So I'll start with your oral medication first. Okay. And this is your DocuSate, 100 milligram tablet. And this is to help soften your stools. Okay. Here you go, Miss Millie. All right. There you go. Thank you so much. Okay. I'm just going to practice some safe hygiene right here. And as I said, you have 2 more medications, Miss Millie. So the second one is the subcutaneous, and it is your medication to help with your blood sugar, your Lisinpro, and it is 10 units sub-Q, so I will give that to you in your belly, in your abdomen, and I'm going to go 2 finger widths underneath your abdomen. Let me get some more alcohol swabs here. Okay, so I'm just going to clean off your belly in a circular motion, Miss Millie. Okay, so as I said, this is your Lisinpro 10 units. It's just a 0.1. Okay, I'm just going to squeeze your adipose here. I'm going to go in at a 45-degree angle. Okay, put that in. Engage the safety. Put the cap away. Put that there. Just cover it up a little bit. Very, very slight pressure. You're not even bleeding. Okay. Would you want a Band-Aid? Yeah, I know you get it so often. You're not even bleeding. Okay. All right. And there's no pain? Perfect. Okay. All right, I'm going to get your other medication. Yes, this is your medication. It is an IM medication. Okay, and if you could go up over on your hip, it is going to be in your vastus lateralis. So it'll be in your right thigh. So I'm just going to put my hand on your hip and your knee. Okay, and then I'm just going to wipe off in between here and spread the tissue a little bit. And this is your Helpridol, 2 milligrams, and this is to help control with your agitation. Okay, I'm just going to spread the tissue here. This is the 1-inch needle. I'm going to go right in and push. Okay, and cover. And apply slight pressure there. Put this in, make sure that's nice and secure so no one gets hurt. And you're feeling okay, Miss Millie? All right, I'm just going to cover that here and apply a Band-Aid. You can leave the Band-Aid on for about 20 minutes. Okay. And you're feeling fine? Is there any pain? Okay, I'm just going to cover you up with your blanket. All right, thank you so much. I'm going to document, and I will be back to check on you in a couple hours. Thank you so much, Miss Millie. Have a nice day. Thank you. Take care.